Welcome to our Population Health Discussion podcast. Populations, of course, are core to a topic called population health. What is the population? Who decides who the population health is? I have a personal bias that traditional population health, as defined by health systems and health plans, are simply plans to show progress toward population health. That limited definition leans toward a population of diabetics or cardiac patients or whomever you're delivering medical services to, and showing that those populations are getting excellent medical care. Our discussion today about population health is going to be much broader than that. And first, we're going to talk about populations and what they are. Where do people live? Where do they work? Where do they access health care? And that broadens the population dramatically. What would followed naturally as the research unfolded, healthcare professional resources metrics, fascinating came out of that, healthcare leadership, and finally building our population by expanding on individual healthcare needs, resources, and leadership. Interesting time, well beyond anything I would have expected at this point. So here we are with a typical real pen model of healthcare in the United States. Individuals in the middle, feeling that way. Organizations who pay on the left. Organizations who deliver healthcare and administer healthcare on the right. And we're going to look at populations within this structure that we use recurrently. First, we're going to take the MSA view, which says there's 384 MSAs in the United States. That's metropolitan statistical areas. And it's 86% of the population, which is about 300 million. Another view of the same population says in what I call a community view, there are 340 incorporated places with over 100,000 people. That really smacked me. That said, that's validating what's going on here. But the difference is it's only 33% of the population, and that there are 19,223 incorporated places under 100,000 people. A fascinating way to look at this. 67% of the population is there. I don't know which way this drives the argument. I know from my perspective, I say healthcare is a local service along with everything else, everything from groceries to roads, safety, education, jobs, name it. Healthcare is integral to that. The hospital-centric view of healthcare and population health is that there are 6,000 hospitals, 216 academic medical centers, 1,800 rural hospitals, and 1,343, which are in those rural groups, of critical access hospitals. Invariably, if we're in the hospital business, we look at the population as the people we serve when they need services, and we have these services to provide to them. So in that context, I looked at medical professionals, and our PCPs are 1 to 1,500, as bad as 3,500 in rural. Nurse practitioners, 1 to 1,200. PAs, 1 to 3,500. And in there, 75 million people are in health professional shortage areas. I had this set up and I looked at it like, what is happening here? And what happened was that there's one registered nurse per 100 people. I never would have guessed that's the way it lines up, because you actually have enough nurses to put these things in place and build those teams that I've been talking about for the last 40 years, that this team of people helps people achieve better health care. Why is this important? Leadership across the board, resources, capital, operations, facilities, education, advancing technologies, and numerous others. That is what ties collaboration between the organizations on the left and the organizations on the right. So this becomes very interesting very rapidly, and that is, if we're hospital-centric, we're thinking about population health, and we go into a community, and what do we have to have in order to serve the community with what we normally deliver? The insurers and health plans are going to say we need members, services, and growth. Actually, what we need is the personal health nurse model, and I'm shocked when this comes to light in this much power. because that's what forms the structure that provides security for health and healthcare. So what happens is it's a member-driven population health. One member, one personal nurse at a time, and one circumstance at a time. What's happening today in the life of a patient is only happening today, and it changes tomorrow. It's one-on-one, one by one day at a time. The member-focused practices with our personal health nurses will be anywhere from 100 to 500, and if you do it the old style we did at Inframed, we had one nurse for about 1,000 people. Still worked really great. Primary care connects that so that we have individuals connected through personal health nursing into the members, and that could be 1,000 members, 2,000 members, typical practice, but frequently they may be more like 5,000 to 10,000. The health systems then serve the population the medical needs, competing on quality and cost, opening the doors to unique win-win structures. So the paths forward: membership is everything, healthy habits, social determinants of health, relationships, information, and connectivity. And the future, I think, is now, and we're going to find wearables and monitoring and all kinds of AI entering the picture. And this structure absolutely prepares us for that. So here we go with the summary. We start out and say, how hard is this to do? Well, it's logical. You got to understand the population. It got messy in a hurry. Can we even agree on whether healthcare is local or not, and what constitutes a community and local, and what constitutes rural and urban? But look at this. You work your way through healthcare one-on-one, moving up through a client-friendly health and social determinants of health-oriented relationships, including engaged primary care, who are also an ongoing relationship, and connecting those teams to the right health system for treatment. Wow, it really works, and we've got proof upon proof that it really works. Note that the structure and operation is a long ways from our current U.S. production and checklist medical-driven unsatisfactory system.